Hi everybody and welcome to AARC's Big Ideas Theater. I'm your host Ed Heiland and I'm joined by a very familiar face, Frank Salvatore. It's been a wonderful couple of years in your presidency here at AARC. Tell us a little bit about, you got regrets, you got things that are coming to the top of your mind here at this point?
Regrets? Oh, if I could do this again for another 2 years, I would do it. But you know what? My time has come to pass the torch. I have lived the dream of being president of the AARC. So regrets, not really. You know, if I could do it again, I would. But you know what? It's time to pass the torch. And it's always good having new blood take over the organization. And I look really forward to Brian's term as president.
Well, that's what I was talking about with the regrets, is just the fact that you're going to have to go now. But you've had this great opportunity, literally, to travel around the world. Tell us a little bit about the message that you've been spreading.
You know, the message has simply been that we as respiratory therapists have to think more about what is healthcare going through now, and it has caused us to change a lot. We're asked to do more with less, and we're also asked, because of changes to the Medicare system, to the Affordable Care Act, we have more transparency and more penalties for the hospitals. And respiratory therapists really have to change from being treatment givers to disease managers. And that's been one of my big messages, is we need to start thinking about doing more education of patients. We can still do the treatments and relieve their breathing difficulties, but when we're told to keep them out of the hospital for 30 plus days, and trust me, it's going to go to 60 or 90, we got to do more to help our hospitals maintain the patient's health and well-being and improve their outcomes. So I think disease management has been a huge term in my 2 years of what we're trying to push towards.
Well, along with all those other factors, now you're basically being required to prove the value. I mean, we know the value, but you're having to prove it. What can you tell folks about continuing in that effort, that vein?
You just have to look at what's out there. We need to use more protocols. We need to show, wherever we work, hospital, home care, we have to show the value to them by improving patient outcomes. If the patient has better outcomes and stays healthier longer, and we have a part in that, that's a huge, huge plus to the healthcare system.
As you're sitting here kind of looking back over the last 2 years, is there something particular you might say that you're most proud of during the course of that time?
You know, I have to tell you, I'm most proud that this organization, specifically the AARC Board of Directors, its House of Delegates, worked well together. And one of the things the board really did was push this profession forward to a bachelor's entry. By us changing our position statement on respiratory therapist education entry into practice, we have found that COARC changed their standards so that the schools now have to be in higher education centers that offer a bachelor's and master's. We're not there yet. We're not saying tomorrow you have to have a bachelor's to enter the profession, but we are well on our way towards building that foundation. So that's been huge the past 2 years.
Have you decided on the next challenge or opportunity to continue to contribute to AARC?
I'm going to continue on as past president for 26 months because I won't end until 2018 in Las Vegas. And I will do anything and everything that Brian Walsh needs me to do in supporting his presidency. I'm also coming back to the Government Affairs Committee, so I can't wait to be working in Washington to get us recognized by Medicare, hopefully under the telehealth bill.
Well, we're certainly glad to continue to see such a friendly and familiar face here at AARC. Thank you for your service and continued success. We'll see you around all the time.
Appreciate it.
And this is the Big Ideas Theater at AARC.